Heather Jenkins from Trust, and she's going to kind of go over open enrollment stuff. If you have more questions, of course, you can call me, and it will be online with Maxwell Health. We just sent out the emails, so you should get those where you can set up a new password. And just an FYI, so, I just sent out the overview yesterday if you have it. Otherwise, we have some more copies. Review the base plan because there have been some changes to that, as well as the cost. If you decide to go with the buy-up plan or family, the cost has changed a little bit. And then now dental is a voluntary product, so if you choose that, you will have to pay for it instead of it being free like it has been. So I'm going to let Heather take over and go over some what she has, and anything else y'all need, just call me or email me. And if I'm slow, just call me or email me again. I'll get it. Thank you, guys.
Hello. As Kimberly mentioned, I'm Heather Jenkins. I am with Trust. Trust is your healthcare advocate, so we assist you with claims, ID card questions about your benefit plans, any issues that you might run into. Please try to utilize us where you can. Kim's passing out the benefit overview. We have plenty of copies, so if you'd like to take a copy, please do. It was also emailed to you. But on this, I just wanted to point out real quick on the back, my contact information, as well as Marita Geist in my office, we're both listed here. We're both available to help you with any of those issues, so please use us where you can, because I know that Kim, Mary Lou, and everyone in the HR office is really busy, so we're here to help, okay? All right, let's go ahead and get started. So we've already reviewed this again. I'm Heather, I'm with Trust. If we're working on a claim issue for you, you will receive an email with this form included in that email. This is our claim issue report. It's a standard HIPAA form. It just gives us permission to work on your behalf. So I just wanted to bring an example of that so you can see what that looks like, and so you're aware that we'll be sending you that form, so that way the carriers will work with us and your doctor's office will work with us as well. I'll go to the next. So 2018 open enrollment is here, so welcome to your open enrollment. As in years previous to this, West Central evaluated benefits networks. We received the renewals. Trust worked through it with West Central to try to get you the most cost-effective, affordable plans available. One of the changes that we did make was the dental did go voluntary, but it is still a very affordable monthly rate, and your rates are listed on the back of this overview as well. So what is open enrollment? This is your decision time for 2018. This is your time to make any changes to your benefit plans, such as adding dependents, removing dependents. Any changes that you make will be effective January 1. If you decide not to make any changes at this time, you cannot change anything until next year's open enrollment unless you experience a qualifying event. And a qualifying event would be anything like a birth, adoption of a child, death, divorce, marriage, or a loss or gain of other coverage. And so what that would mean, let's say you have a spouse that's employed somewhere and they lose their job. If they lose their job and they lose their insurance coverage, that is a qualifying event in order to add them to your plan. But you have to notify HR of that change within 31 days in order to make that change. If it's after the 31st day, you will not be able to make that change until the next year's open enrollment, and that's an IRS regulation there. Go to the next. So we'll review the medical plans. We are staying with Blue Cross Blue Shield of Kansas City. There is still going to be the $1,500 buy-up plan available to you on the Preferred Care Blue network, but there is now the base plan has a $3,000 deductible, and it's staying with the Preferred Care Blue network as well. Because of the changes that we're making to the plan, the base plan, and then also the dental change to make it voluntary, you will receive new ID cards. Okay. This is just a screenshot of the Blue KC website. If you haven't, I would highly recommend that you.
I'm sorry about the ID cards. When everyone checks the mail,
Good point. Yes.
it's going to be a plain envelope, so make sure to open all plain envelopes you get in case it's your cards.
It looks like junk mail for sure. We get a lot of people. I never received an ID card. Well, maybe it got thrown away. Maybe it got pushed aside.
You might have to read that since I'm not a speaker, but
Okay. Yeah. Oh, yeah. Sorry. Quinn or Kim's question there or comment was that ID cards do come in very plain junk mail looking envelopes. So just make sure that you open your mail as it's coming. Or if you think that you didn't receive an ID card, we can always order another one for you. But just an FYI, it does come in a junk mail looking envelope, and that's to protect your privacy, of course. From the Blue KC website, you can view your claims. Your explanation of benefits are available to you. You can review benefits and what benefits you might have available still. You can print temporary ID cards. From there, you can also order your permanent ID card to be mailed to you again. There's some wellness information out there. There's an HRA or health risk assessment that you can take just to kind of track where you are wellness-wise. So definitely take advantage of this site. You can also search for doctors in the network there as well. Goodness. The Blue Card PPO network, so if you should travel outside of this area, you have coverage in all 50 states and 200 countries. So most carriers in other countries, for example, you only have emergency coverage. With Blue Cross, you actually have in-network coverage in 200 different countries. So if you're someone that travels, make sure you take your Blue Cross ID card with you. Next. Preventive care, just a reminder, healthcare reform says that insurance plans must pay for preventive care at 100%. So make sure that you do go in and get your annual physical, your childhood immunizations, your well woman exams, PSA tests. Those should be covered at 100% as long as you are receiving care from an in-network provider, which is the Preferred Care Blue Network, and that the services are in different calendar years. So if you had your last service in December, make sure you wait until 2018 after January to have that service again. So the buy-up medical plan, again, no changes on this plan, has an employee deductible of $1,500 and a family deductible of $3,000 with a co-insurance of 80%. So what that means is once you've met your $1,500 deductible as an individual, you pay 20%, Blue Cross pays 80% until you've reached your maximum out-of-pocket of $4,500. You'll notice that the family out-of-pocket maximum is 2 times. So if you're a family of 3 or more, only 2 people have to meet that out-of-pocket maximum, and then everyone on the plan has coverage at 100% in network. Okay? Can you go back real quick? Sorry. The office visit does have a $25 copay, and your specialist or urgent care copay is $50. Emergency room has a $200 copay plus deductible, then 20%. Hospital is that's inpatient or outpatient would be deductible plus your co-insurance. And then you do have a $100 prescription deductible for an individual on the plan, up to $300 for family, and then you'll have prescription copays. Now all of those copays that I've listed here go towards your out-of-pocket maximum. So your worst case scenario for 2018 as an individual would be $4,500, okay? You can go on to the next. Okay, so the base medical plan here, there are some changes here. The employee deductible did go to $3,000, and the family deductible is $6,000. It has a 70% co-insurance, so again, what that means is once you've met $3,000, you pay 30%, Blue Cross pays 70% until you've reached $6,550 on this plan. Again, it is 2 times for family, so any more than 2 enrolled, and 1 person will have coverage for free if 2 people meet that out-of-pocket maximum. The out-of-pocket maximum does include your deductible, co-insurance, co-pays, and RX. So just a reminder that all of that does apply. That is your worst-case scenario. Office visit on this plan is $35, and your urgent care co-pay is $70. That's specialist as well. Emergency room on this plan is $200 co-pay, deductible, and then 30%. Hospital inpatient or outpatient is deductible plus 30%, and this does have the same prescription coverage with the $100 deductible for an individual, $300 for family. One other thing I wanted to point out that applies to both plans is the mail order benefit. As you can see, it's a 2 times copay. So if you're paying at retail $10 for your prescription, you can get a 90-day supply with Blue Cross Blue Shield, it's a 102-day supply for just 2 times the copay. So if you're someone that's taking a maintenance medication, I would highly encourage you to sign up for the Express Scripts benefit, because not only do you save a copay, they deliver it to your house so you don't have to wait in line at the pharmacy, and it helps just to keep you up to date on your medication so you don't run out, and so you're constantly taking those as well. Okay. So just a reminder, you have options. So if you should become ill, if you can make an appointment at your physician's office. You also have access to urgent care or emergency room. There is another option that you have, which I think is a little bit later in the slide, but I wanted to point it out. You do have the Amwell benefit, which is the telehealth. I don't know if anybody's actually used that benefit this year. This year it is a $49 copay. But if you don't have access to the urgent care, for example, which on the base plan is a $70 copay, or on the buy it plan it's a $50 copay, you can use the telemedicine benefit, which is a $49 copay, so you save on each of the plans anyway, and actually do like a Skype doctor's appointment. So if you have a smartphone or a laptop that has a camera, they can diagnose flu, colds, strep throat, which is my favorite because that means you don't have to go in and get swabbed. You know, nobody likes to do that, right? And so that is another option that is available to you. If you have any questions on that, we can certainly get you more information. But again, it is mentioned in one of the slides here as well, so we'll cover that again. Go to the next. And so one of the other tools that Blue Cross offers is the RX Savings Solutions. So if you have signed up for a portal, you were probably asked if you mind receiving text messages or emails if there are savings opportunities available for prescriptions. And so what they would do is they will send you a text or an email depending on how you sign up. Let's say you're on a medication and there's a alternative drug that is proven to be just as effective, same ingredients available, then they would recommend that drug for you. Or let's say you're getting it from a Walgreens, but it would actually be cheaper through a CVS. They will send you a text to let you know that that drug is actually available at a cheaper price, just to help you save some money towards your prescription costs, okay? Next. This is just an example of when you receive a savings alert, it will take you to a site that looks just like this, and it will tell you that you're on, you know, whatever brand name medication this is, and you have 3 savings opportunities available to you. So it's just kind of a neat tool that is, you know, no cost to you. It's just simply informative to let you know that there are alternatives out there. You can go to the next. And then they have proven that it's about a $300 savings per individual annually if you are taking prescription drugs. So a really neat tool, again, available to you at no cost, so definitely take advantage of it if you are on prescription medication. And then this is the Amwell tool that I was talking about with the telemedicine benefit. You can go to the next. Again, it's just a 24/7 available to you doctor's visit. They will Skype with you. You get put into like a little digital waiting room, if you will. I've actually used the service before, and it was about a 15-minute wait, but I didn't have to drag my infant daughter out to that pharmacy for that minute clinic or for that urgent care center. We were able to diagnose a rash over the Skype, get medication called in for me. I picked up the prescription. That was the only part of it that I had to leave my house for, so it was super convenient. I would definitely recommend taking advantage, plus it's cheaper than the urgent care copay. Okay. Again, they can do sinus infections, bronchitis, cough, flu, allergies. My favorite, again, is the strep, because I don't like being swabbed. Pretty adamant about that. Doctors are available 24/7, 365, so on the holidays included. This is available to you. So we'll review this flexible spending account. Anybody have any questions over the medical? I know we kind of went through that fast. There are some basic changes on the base plan. No questions? Okay. So we'll go on to the flex. Their flexible spending account is still available through Discovery. This year, we will allow up to $2,400 to be taken out pre-tax. It is taken out over your payroll periods evenly throughout the year, but you elect an amount, and that amount is available to you on January 1 of 2018. That is for the medical flex, which you can use those funds then for medical expenses, dental expenses, or vision expenses. So if you're someone that gets glasses or contacts, you can use the FSA funds to pay for those services. There's also a dependent care FSA. The dependent care, you can put aside up to $5,000 throughout the year, and as that money is deposited, you can use that to pay for eligible dependent care expenses. And again, those are available to you as they're deposited, so unlike the medical flex, which is available on day 1, this one, as you put into it, you can take out of it. But it's pre-tax, so it lowers your taxable income and saves you on your taxes that way. For the FSA contributions, I'm sorry, that should be changed. I apologize. That should say $2,400 for 2018, and then $5,000 for your dependent care. It is corrected in here, so you can see the flex is listed as one of the benefits here. Make sure that whatever you elect for the medical that you do actually plan to use, it is a use it or lose it account, which means if you elect, let's say, the full $2,400 and you use $1,000 of it, you're going to lose that other $1,400. So we want to make sure that you are electing what you know you'll use within the year. There is a list at the irs.gov website of what eligible expenses would be, but you can use it for your co-pays on your medical plan. You can use it towards your dental expenses, your dependents' dental expenses, as well as vision. Again, I'm going to do this. So reviewing the dental plan. This one will be offered now on a voluntary basis, but there are no changes to the actual plan design. Dental coverage is listed on your medical ID card if you're someone that also takes medical. If you take dental only, then you'll get a dental ID card only. So just to review the dental plan, the annual benefit maximum is $1,000 per person enrolled. So if you're enrolled with dependents, each one of you has a $1,000 max available to you. Preventive care is covered at 100%. There is a $25 individual deductible or $75 for family, but that only applies to your basic and major services. Basic services are covered at 80%, and your major services are covered at 50%. The vision plan, this will continue through principal. It is on the VSP Choice Network, which is listed in your overview as well. You can log into an account at principal.com to view your benefits and see where you are with tracking your claims. So if you're someone that maybe does, we can go to the next slide actually because I think it's explained on here. If you're someone that wears contacts and glasses, you can track to see when your last contacts or glasses were received. Unlike the medical plan, which is January through December, if you have your preventive services, let's say in February, you can still get them again in January. On the vision plan, it is by the actual date that you have services completed. So let's say you get glasses on March 1st, you wouldn't be eligible for glasses again for 24 months from that March 1st date, okay? On the principal website, you can actually track to see when the last time you had services performed. So you can kind of track that. I just don't want anybody going to the eye doctor thinking that they have coverage and then you don't because of that date rule there. On the exam, it is every 12 months with a $10 copay. Your single vision lenses every 12 months with a $10 copay, and then bifocal or trifocal lined lenses also every 12 months at a $10 copay. Again, frames are available to you every 24 months, and that's a $150 allowance, and then a 20% discount over the allowance. And then your contact lenses are available to you every 12 months, but there's a $60 copay for the exam, and then a $150 allowance for contact lenses. Again, if you're someone that uses both, I would recommend, if this is your first time joining the vision plan, I would recommend that you get your frames this year, and then next year, you'll have the 12-month waiting period up for your contacts, so you can get your contacts, and then the next year you'll be eligible again for frames. So it's just kind of the easiest way to use the plan. We'll go to the next. So the open enrollment checklist for you would be to definitely review your benefits for 2018, review what's in this information here. Again, your rates are included on the back. Contact and website information for each of your carriers is also listed here, as well as the Blue KC 24-hour nurse line. That nurse line can be used as a triage. If you're not sure if you need to go to urgent care, you're not sure if you need to go to primary, you're not sure if it would be a telemedicine benefit, you can call the nurse line and ask them for a recommendation on where you should go or what you should do. You are going to enroll again through Maxwell Health. As Kim mentioned, we just sent the email out this morning, so you should receive an email that instructs you on how to register or how to log into the portal to make your elections. It's the exact same as last year, so if you get stuck or if you have any questions, you can contact either Kyla or myself or the HR team. They can help you get back in or get information there. And it is open as of today, and we will close it as of next Friday. And so that allows us time to then gather that information. It'll go to the carriers, and ID cards and things like that will be sent out. So make sure that we aren't tracking you down close to the 8th. Make sure that you do enroll as soon as you can, just to make sure that we get everyone's elections in as quickly as possible. So we don't want to delay any enrollment. I think we can go to the next. I think that's the last. So again, if there's any questions, if you have a personal situation that you want to talk through, I'll stick around for a while afterwards. I'm happy to talk through it, or if you have any general questions, I can take them right now as well. Yes?
With the prescription solution thing where they tell you who has the best price, normally when I'm in my doctor's office, he'll say, where do you want this sent from the prescription? And he does it online. So is it quick enough so that I can look it up right there in the doctor's office? Do I get a response back that soon?
Sure. Mary Lou's question was on the RX Savings Solutions tool. If she receives a prescription at her doctor's office, they process it online, so there's not really much choice. You tell them where to send it, but you don't really see the savings opportunity right there. You can actually use the RX Savings Solutions. You can log in and list out your medications that you're being prescribed, and it will give you options. They also will look at what has been prescribed to you, and they might even send you a text before you even leave the doctor's office, just depending on how quickly it gets submitted to Blue Cross. Sometimes too, maybe your first opportunity, you don't take advantage of that savings, but then after that first bill, they'll send you the text or the email, and then you can take advantage of that second time. But definitely, if you can log in, go ahead and enter in what's been prescribed to you, and they will make recommendations according to that. Okay. Great question. Anybody else?
If there's any questions in the counties, if you'll type it in the chat.
And I feel like we went quickly. There's not many changes this year, just that one change to the base plan. So I think it's really just a review, but any pop up there? All right. Well, thank you, everyone. I appreciate your time. Again, if there's anything I can help with or anything I can answer, please definitely take advantage of me. My information's on the back here, and I'd love to be your advocate for your healthcare, okay? Thank you.
I do have one question. It says, how do I sign up for Vision?
When you log into the Maxwell portal, you'll go through each benefit, and Vision will be one that's listed, and you can actually sign up through the Vision benefit there on Maxwell's portal.
The other thing I wanted to mention, if you're not going to select a project, make sure to click on it and waive it. A lot of people forget to do that, and it just sits out there, but waive what you don't want, and then that step gets missed a lot, so.
And make sure you update your beneficiaries too. That's something I usually try to say at open enrollment. We've had to pay out to a lot of X's on beneficiary claims. We don't want that to happen to anybody. It's usually a court battle. So if you can take the time to go ahead and update those beneficiaries in Maxwell, just so we have the new ones on file. It's never a comfortable conversation.
Which, and then that made me think of the FSA. Several times last year, a lot of people just signed up for it, and so it automatically just kicks in $10. Well, that's, $10 over a 12-month time frame is kind of silly. I mean, it's not even $1 a month that you're putting in the FSA. So make sure that you put what you actually want in that amount if you sign up for the FSA.
So it doesn't carry over?
You have to re-elect every year or waive every year. It's a lot easier now though, since we have the online system, so hopefully everybody can get through that. Okay, well thank you very much again.
Yeah.